Here are some ways to improve incontinence after prostate cancer treatment. Ways to improve incontinence in men would start with exercises. Kegel exercises, which you normally hear for women, can be done in men. In fact, it's easier to do in a man than in a woman. Kegel exercises should be done on a regular basis. I have my patients do 20 contractions for 5 seconds, relaxing for 10 seconds in between, and doing that 3 times a day for a total of 60 contractions a day. This will exercise the sphincter muscle and over time build it up and help improve incontinence. Other ways to improve continence after treatment for prostate cancer or for other reasons would include watching your diet. Beverages such as caffeinated drinks, soda pop, and other bladder irritants can make the bladder have higher pressures and sometimes contract irregularly and cause incontinence. A diet that is bland or has very few spicy foods or acidic foods often will help with this. Drinking more water and less carbonation or coffee and tea will also help. There are medications that can help with incontinence also. There are medications which we have used for years called anticholinergics. A common one is ditropan or oxybutynin. In the last 5 to 7 years, there have been 6 to 7 new medications, and there's even a new class out that is a beta-3 agonist that helps block the effect and the desire of the bladder to contract. So between exercises, dietary modification, and medication, most men can have benefits and help with their incontinence. If all these fail, there are surgeries that we can perform that can help with continence. Surgeries can be anywhere from injecting a material to bulk up the urethra to a sling procedure, which is something that will place tissue underneath the urethra to help obstruct the tissue and help prevent incontinence. And then the most aggressive would be an artificial urinary sphincter, which is a sphincter that goes around the urethra and is pumped up to open up to allow you to urinate when you feel the urge to urinate.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.